Hi, my name is Katie, and today I want to talk to you about a couple of different certifications that I am interested in pursuing once I complete my DPT degree. So, the first one that I want to talk about today is something I am very passionate about, and that is becoming a certified yoga instructor. Yoga is a form of exercise that combines stretching with meditation and breath work. And I started practicing yoga about a year and a half ago, and it has been so beneficial to me in terms of improving my stress and also my anxiety, and also improving my strength and flexibility. Becoming a certified yoga instructor entails completing at least 200 hours of supervised yoga teacher training with a registered yoga school. And the curriculum is centered around learning poses, alignment, anatomy, and then also how to properly teach those things to a class. Yoga is both a preventative and restorative practice and has shown to be highly beneficial to all kinds of different people all over the world. I feel that learning principles of yoga more in depth would also help enhance my knowledge of physical therapy, and that I would be able to apply principles of evidence-based practice to yoga as well. And in addition, yoga teaches patience, understanding, and peace, and these are qualities that I want to both have and be able to teach other people in my practice as a physical therapist. So yoga really embodies a very holistic approach, and that is one thing that I really love about physical therapy as a whole, is that we really treat the whole person. In a physical therapy session, a lot of the times we are also addressing psychological and motivational ailments and trying to work through those. And I really feel that being able to implement yoga would really help me become a more empathetic and well-rounded physical therapist. Yoga is about being very intentional and aware with your movements as well as your mind. And upon researching this topic, I found a PT who was involved with implementing yoga into her physical therapy practice. And she said, quote, that it is important to focus not just on treating the symptoms, but finding the cause and treating the imbalances from that. I feel that taking on a very well-rounded approach to healing would lead me to becoming a better clinician and then also a better certified yoga instructor as well. I really feel that both of those together can have a lot of benefits for me as a clinician. So that brings me to my next certification that I'm interested in, and that is a residency. So the specialist certification program was established to provide formal recognition for physical therapists with advanced clinical knowledge, experience, and skills in a special area of practice, and to assist consumers and the healthcare community in identifying these physical therapists. So there are numerous reasons that a residency can add a lot of value to a physical therapist. So it's a way that a PT can continue formal education post-graduation. And I feel that in committing to this profession, we are also committing to being lifelong learners. And in that sense, we really cannot have too many mentors. And a residency allows you to have very guided, specific mentorship. A residency can also help prevent burnout and then also prevent you from becoming complacent in your practice. It will help keep things new, you can learn new things. It's just extremely beneficial and can ultimately lead to a higher quality of care as a physical therapist, which is definitely something that I think both therapists and patients want. So the residency that I am most interested in is an orthopedics residency. And an orthopedic residency would center around deepening my understanding of musculoskeletal conditions in a variety of different settings and contribute to me becoming an even more well-rounded and experienced therapist for conditions that I'm most interested in working with. I feel that adding this certification to my list of credentials would also increase public trust in me as well as increase my autonomy as a therapist, since I would have sought out more education than the average therapist. And this brings me to my next point of direct access within the clinic. So, direct access allows a patient to see a physical therapist without waiting for a referral from a physician. And this really places the medical decisions of the patient in their own hands, as well as also contributes to the autonomy of PTs, since we are doctors after all. Direct access has also been shown to lead to a quicker recovery. It is more simplistic, and it also helps to take out the bias of referral for profit practices. So the APTA has been making strides in direct access for many years, but unfortunately Tennessee is still under some limitations, which means that patients are still restricted in terms of visits and treatments. And it is my hope that in the next near future that we can really lift some of those limitations and allow direct access to be available unrestricted in all 50 states. And I really hope that in bettering myself as a physical therapist with additional certifications can help increase more public confidence in the entire profession. So this is my list of references. Thank you so much for listening. That's all I have.